Tomorrow marks the beginning of what may be the most important phase so far of the president's health care overhaul. Tonight, Chief National Correspondent Jim Engel reports there are not too many people expecting a smooth start.
With President Obama's signature legislation on health care about to begin, there are still numerous questions about how and whether it'll work.
ObamaCare succeeds or fails based on enrollment, period.
Most important is whether young people sign up, without whom Obamacare will face enormous problems.
The key are the young and healthy who don't have big medical bills, but whose premiums will be used to cover the costs of the older and sicker.
Younger people are subsidizing older people in this law because healthcare costs for older people run more than 7 times more than the cost for younger people.
The key question then is how many young people will sign up. One researcher found the financial incentives may discourage many young people from enrolling.
A lot of them in that age group, 18 to 34, would actually save at least $500 by foregoing insurance on the exchange and simply paying the penalty under the individual mandate.
About 3.7 million young people would save that much, he found, 3 million of whom would save about $1,000. With the fine for not having insurance only $95 the first year, and many young people spending far less on medical care now than Obamacare would cost them, analysts fear the young will pass it up.
I think it's just one more thing that's going to discourage young and healthy people from signing up.
Another potential problem, both state and federal exchanges have been having problems verifying incomes and who qualifies for subsidies, which could delay signing up.
Glitches we've seen so far include things like a calculator that people were supposed to be able to use to figure out what their premiums would be for different policies. Doesn't work.
After hyping October 1st and the day a brand new insurance plan would begin, over this past weekend, administration officials were playing down the rollout they once touted.
Now they're faced with the potential for a poor launch of their signature domestic program. They're trying to set these expectations as low as possible.
And any administration failures could discourage the young, the most web-savvy generation ever.
October 1st is going to be important whether they think it is or not. If these websites are not really functional on October 1st, that's another thing that's likely to drive young and healthy people away.
And those on all sides agree on one thing. If the young don't sign up, Obamacare will be far, far more expensive if it works at all. Brett?
Jim, thank you.